Hello everyone, I'm Dr. Bhavna Joshi and I will be taking the subject creating an inclusive school. So in this subject today we will be discussing about the second type of disability, that is hearing impairment. This topic is in your unit 2 of creating an inclusive school, year 218. So let's start. What exactly is hearing impairment? Hearing impairment is the inability of an individual to hear sound adequately. So this may be due to the improper development or damage or any kind of disease on any part of hearing mechanism. That means, in simple words, a person is not able to hear the sounds properly. Now, there are various degrees of hearing loss. It is not that hearing impairment means that that person is not able to hear completely. There are different degrees of hearing loss. The first one is slight hearing loss. Slight hearing loss means inability to hear sound between 16 to 25 decibel. Hearing a slight hearing loss means that there is a difficulty in hearing very soft sounds like falling of leaves or whisper or dropping of a pin. So a child who is having slight hearing loss can experience difficulty in classroom, especially if the teacher is more than 3 feet away. And it will be made more difficult for the child to hear in a noisy classroom. He or she will not be able to understand the conversation properly. Now, then the next level is the mild hearing loss. Mild hearing loss is the ability to hear, inability to hear sound between 26 to 40 decibel. And it means that the child is having difficulty in understanding conversation that is soft, like whispered talks, chirping of birds, and the sound of gentle steam. Now, for these children, conversation becomes harder if the uh, environment around them is noisy. So, the child with mild hearing loss can have difficulty in understanding the communication in classroom, and they may also fail to understand some words, specifically if there is lot of noise in the class. Now, the next level is the moderate hearing loss. It is inability to hear sounds between 41 to 55 decibel. And with moderate hearing loss, there is difficulty in understanding normal speech and comprehending the speech, what they heard. That means they are not able to comprehend if, and it is more difficult if there is a lot of noise in the background. So, children with moderate hearing loss can have trouble in developing learning skills due to difficulty with understanding communication. See, they are not able to understand and they are not able to understand and comprehend the speech also in this moderate hearing loss stage. So, people with moderate hearing loss should use hearing aid to be able to understand the conversation properly, specifically in noisy class environment. The next is moderately severe hearing loss. This is the inability to hear sounds between 56 to 70 decibel. And it is like sounds, if you are having conversation in a restaurant or an office, and there is little bit of noise, people are talking to each other. The noise produced by vacuum cleaner, the sound of a shower or a air conditioned unit at 100 feet, they are not able to hear it. So children with moderately severe hearing loss cannot hear sounds and develop problems with their own speech and language development if not treated by speech therapists. So these are moderately severe hearing loss children. They are not able to hear the normal sounds also, and they, because they are not able to hear normal sounds, so they face difficulty with their speech and language development also. So you need a speech therapist also for these children. So as I said earlier also, people with moderately severe hearing loss should use hearing aid. Next is severe hearing loss. Now, this is the condition of a person who has inability to hear the sound between 71 to 90 decibel, which means that sound in this decibel category include sound of a train at 50 feet. They are not able to hear it. Passing of trucks, the sound produced by squeezing a toy or normal television volume in the living room, they are not able to hear it. Noise of a food processor, they are not able to hear it. So this is what is severe hearing loss. So because people with severe hearing loss require others to speak at a very shouting level, you can say not loud but at a very shouting level, so that they are able to hear it. So children with severe hearing loss need speech therapist also, so that their language and speech development is proper, and they need proper social skill development also. And as in the previous category also, they also need the hearing aid. So the last degree is the profound hearing loss. So it is the inability to hear sound at 91 decibel and above. In this, the sounds include the sound when riding a motorbike or music at a loud concert. They are not able to hear it. Those who are having profound hearing loss. The volume, the sound of aircraft landing at a distance, noise in a train, or sound level in sports stadium. These are the category for profound hearing loss. Then at this hearing loss level, even loud speeches may not be heard. So children require auditory training. They need auditory verbal therapy, hearing rehabilitation, um, uh, sign language instruction should be given to them. Lip reading classes and speech therapy should be given to them. Now, after the degrees of hearing loss, now the types of hearing impairment. Now, the first type is conductive hearing loss. Conductive hearing loss, it is the result of obstruction in outer or middle ear, which prevent sound from entering the middle ear. Because the sound is not able to enter the middle ear, the voices and the sound usually are faint or are distorted. So most conductive hearing loss cases may be treated medically or surgically. Now the next type is sensory neural hearing loss. Now it occurs when inner ear nerve are damaged and do not properly transmit sound signal to the brain. So this may be caused due to withering of the hair cell in the inner ear due to age, or due to some noise damage, or due to some medication. So without healthy hearing cell, the ear cannot detect sound properly. So this is with the case of sensory neural hearing loss. Next is mixed hearing loss. Mixed hearing loss is a combination of sensory and conductive hearing loss, which we already studied. The last one is central hearing loss. Since central hearing loss is due to damage, malformation, or infection of neural pathways and the hearing center in the brain. So the child may hear and has difficulty in understanding what he hears. So this is about central hearing loss. Now, the educational provision for these children. As a teacher, we can give them communication techniques like lip reading, sign language, auditory training can be given. Use of hearing aid can be used. Then use of appropriate teaching aids, like they can learn more by seeing than hearing. So figures, pictures, models, and maps should be used. Then uh, it is always better to provide them a helper or a taker who can take notes on their behalf. Computer assisted instructions should be given. Provision for resource room and a resource teacher should be there. Then basic motive should be of their education should be to provide them educational and vocational guidance so that they are independent in future. So this can be, these are the few educational provision for hearing impaired children. So I hope you all understood about hearing impairment. Thank you very much.